cause of total hip replacement failure. Aseptic loosening, which refers to the failure of joint prosthesis without the presence of mechanical cause of or infection, is often associated with osteolysis, called as bone resorption, and an inflammatory cellular response within the joint. Second, it is because of metal on metal total hip arthroplasty (THA) occur due to the aseptic loosening, metal hypersensitivity reactions, pseudotumor formations, and component seizing. The third one is prosthetic joint infection, which is called as PJI, also referred to as periprosthetic infection, is defined as infection involving the joint, prosthesis, and adjacent tissue. The fourth one and the last one is instability is one of the most common complications after total hip arthroplasty and can present early or late after hip replacement. Late instability is considered if the event occurs 5 or more years after the primary arthroplasty, and it contrasts to early discolation. It appears to require operative interventions.
How to overcome failure of total hip replacement is by drinking plenty of water. It is absolutely essential to stay fully hydrated post-surgery. This is done to avoid potential surgical complications, including vein thrombosis, which is a clot that is built up in the major veins of the thighs and legs. The patient can also suffer from pulmonary embolism. After the surgery, our immune system is extremely weak, thus increasing the chances of an infection. Water helps keep these infections away and acts as a catalyst to recovery. Furthermore, water helps body get rid of toxins from the anesthesia. So drinking water post-surgery, total hip arthroplasty can be very helpful in all aspects of recovery.
Second point is avoid the production of wear particles. So this is the greatest way to prevent aseptic loosening is to avoid the production of wear particle in the first place. This can be accomplished by addressing implant design, patient characteristic, and surgical factors during the procedure. The material characteristic of the implant, the bearing surface implant modularity, shape, and method of fixation are the most significant implant parameters associated with the development of wear and aseptic loosening. The amount of wear particles is most determined by the materials used. Implant functioning on a bearing surface must have a low coefficient of friction, be hard to increase crash resistance and reduce adhesive wear, and have a low surface roughness to prevent abrasive wear. Wear risk can be minimized by choosing materials with specific characteristics that inhibit the formation of wear particles, resulting in less aseptic loosening and implant failure.
A type of hip replacement surgery called the direct anterior hip approach can make the early recovery after surgery even better. This is a minimally invasive technique. With anterior hip replacement, the surgeon makes a small incision near the front of the hip to allow for removal of the matched bone and cartilage, and implantation of an artificial hip without damaging surrounding muscle and tendons. Patients leave the hospital sooner than they would with some other approaches.
Number 4. How to overcome. Taking antibiotic. Postoperative antibiotic prophylaxis is currently the standard of care for patients undergoing total hip and knee arthroplasty. Antibiotic prophylaxis is effective at reducing the infection rate in primary THA. Therefore, the patient need to taking antibiotic regularly. Regularly check up after surgery. This is compulsory to make sure that the hip implant is in the right position, especially for patients who have active lifestyle.
And this assignment is biomaterial assignment about the hip surgery replacements. And then as shown in all the slides above, we have done all how to overcome the issues and how to solve it out and how programs. And now my part is to talk about biological evaluation of the total hip joint replacement as part of risk management process based on ISO 10993. Yes, there are numerous features to an orthopedic surgeon's evaluation, such as medical backgrounds and examinations about the body. Your orthopedic surgeons will seek information about your general health and the amount of your hip problem, as well as how it improves or impacts your ability to do daily tasks like walk-ins. And all of these basic needs will be investigated by your orthopedic surgeons. For example, of the examinations of the body, the mobility, strength, and alignment of the hip will be evaluated. The mobility is like the movement and then how strong it is, and the alignment with how they contact each other will be examined by the orthopedic surgeon. 3. The photo aid in the determining the amount of your hip injury deformations. Other tests, such as magnetic resonance imaging (MRI) scan may be required in some cases to determine the quality of your hip based on the soft tissue. MRI tests are very famous, popular among these days, which is really good for the body, like the hip this the industries about the replacements, which can literally help about the soft tissues and all of these organs by using the MRI scans. And also I have described the endpoint of these tables with the endpoints, so like you can see clearly the endpoint to be addressed in the biological risk issues with the tables. I've combined it into cardiology and the contact. In cardiology there's like surface medical devices, extended communication medical devices, and in the interskin types there is a membrane and the branch also the compromises surfaces and blood by tissue, bone, and an occlusion blood. And all of this with the endpoint of ECA, and then you can just see it clearly.
Main parts of a total hip implant consist of four parts: femoral head, acetabular cup, linears, and the femoral stem. For the femoral head and the acetabular inner cup, we are destined to use ceramic. As for the liners, we are using polyethylene, and for the acetabular outer cup and femoral stem, we are using cobalt chromium metal. The characteristic of this material used in total hip implant design, because of its outstanding tribological qualities such as favorable frictional behavior and great wear resistance, alumina ceramic has been one of the most often used ceramic in THA. Its mechanical resistance, on the other hand, is lower than that of other materials. It performed well in compression but had poor resistance in tensile stress. Because of its hardness, alumina ceramics have been employed in therapeutic applications for their tribological qualities. Alumina is arguably the most widely used material in ceramics. Cobalt chromium alloys, which were formerly only used in dentistry, are now one of the most often utilized materials for hip prosthesis. Cobalt chromium alloys are a popular implant materials due to their high strength, corrosion resistance, and wear resistance. Because of its higher Young modulus than titanium alloy and wear resilience, it is mostly employed as a cement type femoral stem material. On the other hand, polyethylene, polyurethane, polytetrafluoroethylene, polyester, and polyoxymethylene are all polymers that have been utilized in hip implant arthroplasty because alternative polymers did not have the requisite wear resistance in their early formulation. Polyethylene was the most usually utilized.